Good evening, friends. What do you mean by hoarding disorder? There are some people who keep on accumulating things. They know that they are useless things. It unnecessarily occupies an entire space in the house or maybe in the office also. Cluttering, cluttering, and cluttering. But despite that, these people are not in a position to resist their urges to accumulate things. Accumulate what? Various articles, pens, papers, old telephone sets, old mobile handsets, blah, blah, blah. They keep on accumulating things, and the moment somebody tells them to discard those things, they develop intense distress. They develop intense anxiety, sometimes intense depression also. This is called as a hoarding disorder. They just can't part with their possessions, materialistic things. They keep on accumulating items. These are not needed. It occupies a whole length of space in the home or at the office, but still they cannot resist their temptations, their urges to accumulate things. It can impair their personal functioning, their family functioning, social functioning, educational functioning, and it can impair their occupational areas also due to this intense cluttering of things in the office space or at home. They keep on buying things repeatedly. The person buys one car, another car he wants to buy, another auto rickshaw he wants to buy, another the latest motorcycle he wants to buy. He knows that he can't use all these things. They're useless, but it occupies the garage of this particular person. Amassing huge property. He has one home at Hubli. Not happy with this. He wants to buy one more flat in Bangalore, another in Bombay, so on and so forth. He just can't discard his possessions, he or she. Both the sexes can be equally affected. Is it a mental disorder? Yes. According to Diagnosing and Statistical Manual of Mental Disorders number 5, this hoarding disorder is undoubtedly, undeniably classified as a psychological ailment, as a mental disorder. What are the causes, my friends? Not clear. Neither can you say it as idiopathic also. The causes are not clear, but two things are absolutely important. One, a strong genetic loading in the family. If some person in the family has had this disorder, it can be transmitted through genes to the next progeny also. Plus stresses, life stresses, stressful triggering factors. Who doesn't have stress nowadays? Everybody has. This intense traumatic event, maybe of any kind, intense stressful factor can trigger off a hoarding disorder. What are the risk factors? The one who has undergone traumatic event. For example, if a theft has occurred in one of the person's house, next time he may be doubly cautious to keep on accumulating things, to keep on the ಶೇಖರಣೆ ಮಾಡ್ಕೊಡೋದು ಅಂತ ಹೇಳ್ತೀವಲ್ಲ, ಗೊತ್ತಿರುತ್ತೆ ಇದು ವೇಸ್ಟು ಅಂತ, ಆದರೂ ಕೂಡ ಅಲ್ಲ ದೂರ ಮಾಡಲಿಕ್ಕೆ ಆಗ್ತಾ ಇರೋದಿಲ್ಲ. ಹೌ ಇಸ್ ದ ಪ್ರೊಗ್ನೋಸಿಸ್? ಇಟ್ ಇಸ್ ಎ progressive disorder. It can't be completely cured. Though, of course, psychotherapeutic intervention, CBT as we call it as cognitive behavioral therapy, antidepressant treatment, it can reduce or perhaps it can curtail the suffering in these patients. It can lead to depression, it can lead to anxiety, it can lead to an obsessive compulsive disorder. OCD people are the ones who are more prone to develop this hoarding disorder. Autism spectrum disorders, ADHD, attention deficit hyperactive disorder, they are the ones who can develop these things. Another thing I want to stress, my friends, alcohol dependence. People who are dependent on alcohol, they can develop this hoarding disorder too as a catastrophic consequence. Then in psychotherapy, we do what's called as a motivational interviewing, harm reduction, and group psychotherapy. It should help such individuals. Thanks a lot for watching the video. Please do share it. Bye bye. All the best. God bless you.